Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is has not been mentioned, but we are going to take you through whatever we see interesting. As you can clearly see, this is the canine on the right hand side. The teeth look appropriate. All the sizes are fine. But when we look at the left side, we see a deciduous canine is present here for this patient. And then as soon as we move posteriorly, we'll be able to see that there is a canine which is impacted palatally placed of this patient. So we have an impacted canine case. This is looking at the tooth from an axial point of view. Axial means top to bottom. So we're looking at it from the top, and as we are moving towards the maxillary incisors, we can see that the canine is placed between the central incisor and the lateral incisor palatally in the upper left hand quadrant. Now, on the transaxial view, which is going to be the proximal view, we can clearly see this is where the canine is present. So this is the crown of the canine. It seems to be almost erupting from the soft tissue as well. It definitely has erupted from the bone, and orthodontic movement of this case will enable the tooth to come back into its original position. It is definitely in contact with the lateral incisor here. This is where the lateral incisor is. We can see how closely associated this is. It is not in contact with the central, but it is also very closely associated. But the canine, the deciduous canine also, there we go. So this is the deciduous canine, and we can clearly see the roots have been resorbed, and the roots of the apical one third of the permanent canine is definitely in contact with the roots of the deciduous. So if there are any further questions, please feel free to reach to our team. We will be extremely happy to help. Thank you very much.